There is often a strong connection between experiencing a traumatic event and using substances as a coping mechanism, so trauma and addiction treatment is necessary for a lasting recovery. Coping with trauma is an uphill battle. The profound sense of isolation, a feeling of helplessness, living in constant fear, impulsiveness, and irritability associated with traumatic events can be detrimental to a person's ability to function socially, at home, or work. If these concerns are not resolved, they can be developed into serious long-term issues including depression, PTSD, drug addiction, and anxiety disorders. Regardless of the traumatic event you've experienced or how far gone you feel, there's hope. There are several treatment modalities that can help you live a normal life. At Destiny Treatment Center, we employ a variety of tools to employ the outcome of your recovery, and some of them are unique to the treatment community. However, effective treatment is hinged on identifying when it's time to seek professional trauma therapy. Some people are either reluctant to go through the recovery process or they don't even know that they're victims of past traumatic events. For this reason, it's imperative to understand the causes of trauma, types of trauma, how trauma is linked with addiction, trauma and addiction treatments and interventions to help you live a normal life. The American Psychological Association, APA, defines trauma as an emotional response to a trouble event like an accident, rape, or natural disaster. In other words, a person who has witnessed a violent or tragic act, experienced intense pain, or feared for his or her safety has experienced trauma. However, not everyone who has experienced a stressful or traumatic event develops a diagnosable mental disorder. In fact, 50% of the population has or will be exposed to a traumatic event. Some will be able to cope with the trauma, but for those who don't, they may tumble into a path of long-lasting complications, some life-threatening. Of particular concern is the risk for developing post-traumatic stress disorder. This trauma disorder can severely disrupt the behavior, thinking, emotions, relationship, and even physical health of trauma victims. Although people tend to associate it with life-threatening incidents such as war and assault, the reality is that trauma can be caused by a wide range of incidents, and it manifests in a variety of psychological and physical symptoms. Any situation that overwhelms your ability to cope with normal life events can result in trauma. The more helpless or frightened you feel, the higher the chances that you'll experience symptoms of trauma. For this reason, the impact of a traumatic event is determined by your subjective experience of the situation rather than the objective circumstances. This is the reason two people might undergo the same level of traumatic exposure, but they portray varied symptoms. Ongoing events such as neglect by a parent, repeated bullying or harassment, struggling with a terminal illness, living in a dangerous neighborhood, combat area, or wartime environment, abusive relationship, one-time incidents such as physical assault, a terrorist attack, accidents, natural disasters, sexual assault, and extreme verbal abuse. Emotional events such as the sudden death of a loved one, a difficult breakup, an act of cruelty, especially in childhood, or humiliating experiences. It's important to note that you don't have to be directly involved in a traumatic or stressful event to manifest psychological, emotional, and physical symptoms of trauma. For example, even though very few people will be direct victims of a violent attack, the horrific image circulated on social media may cause traumatic stress to a viewer several miles away. Similarly, children who grow up watching their parents engaged in violent arguments may have long-lasting traumatic experiences. The emotional, physical, and psychological manifestation of a trauma event depends on several factors, such as the personality type, existing life stressors, ability of support, coping mechanisms, and nature of incident. Generally, trauma disorders can be grouped based on the sign and symptoms observed. At Destiny Treatment Center, we offer help to victims of various types of trauma disorders, including their related conditions such as addiction. Statistics from the U.S. Department of Veteran Affairs show that up to 8 million American adults struggle with PTSD in a given year. Additional numbers show 43% of children to go through traumatizing events, with up to 6% of boys and 15% of girls developing PTSD. The symptoms of PTSD are typically long-lasting and the more severe in comparison to other trauma disorders such as ASD. Victims typically experience flashbacks or distressing memories of the traumatic event, irritability, sleeping problems, emotional numbness, and feelings of negativity. They also portray reactive symptoms such as aggression, outburst, always being on guard, startling easily, and engaging in self-destructive behaviors, especially drug abuse. The signs and symptoms of acute stress disorder, ASD, are similar to those of PTSD, except that it occurs within 30 days after a person's exposure to the traumatic event. ASD is a risk factor that may lead to PTSD if appropriate social support and trauma therapy are not provided. Adjustive disorders are characterized by an unhealthy response to changes or stress. A diagnosis of the disorder requires a person to experience symptoms that impair some areas of their life. Signs of adjustment disorders include difficulty functioning normally, avoiding responsibilities, social withdrawal, loss of appetite, nervousness, difficulty sleeping or insomnia, feelings of hopelessness, extreme sadness. Reactive attachment disorder, RAD, is a condition in which a child is unable to connect with others or manage their emotions. This disorder is relatively common in children who have experienced trauma, such as being separated from their primary caregiver, living in orphanages, or victims of abuse. Signs of adjustment disorder include an aversion to touch, difficulty showing genuine affection, anger problems, emotional control issues. Similar to RAD, disinhibited social engagement disorder, DSED, is a childhood attachment disorder characterized by a lack of fear towards adult strangers, little to no hesitation around strangers, and acting without the permission of parents or primary caregivers. According to the Substance Abuse and Mental Health Services Administration, the relationship between interpersonal violence or trauma and substance use disorder is significant and complex. At Destiny Treatment Center Trauma Therapy Program, we look at the link between addiction and trauma from two perspectives. Addiction may arise from the use of drugs to cope with the symptoms of trauma. Individuals burdened with trauma symptoms such as anxiety, fear, shame, irritability, sleeping problems, or hypersensitivity may turn to drugs or alcohol as a way to cope and self-medicate. The constant and overwhelming feeling of emptiness or dread makes them yearn for relief, which they temporarily find in unhealthy behaviors. For example, someone may consume stimulants to gain the energy and focus they need to push through the day, opiates to experience a brief moment of euphoria, or alcohol to function in social settings. These temporary fixes open the doors towards drug addiction, and after a while, the drugs no longer offer the same relief they crave or previously experienced. In effect, they become another thorn in the trauma survivor's life. The high-risk behavior associated with drug abuse increases the person's exposure to potentially traumatic events, impaired driving, dangerous neighborhoods, questionable acquaintances, and other aspects associated with drug or alcohol abuse to predispose addicts to trauma, causing violence, accidents, and crime. In addition to the aspects mentioned, people who abuse drugs and alcohol also tend to cope ineffectively with new traumatic events. Whether trauma predisposes a person to addiction or vice versa, the correlation between the two is undeniable. There is compelling evidence that links different types of trauma and addiction. Drug and alcohol abuse is often used as a means to cope with traumatic memories of sexual assault. Some studies suggest that over 50% of women in substance abuse rehabilitation programs are victims of sexual assault or abuse. Additionally, a study appearing in the Psychology of Women Quarterly shows that women with drug and alcohol problems are more vulnerable to violence, assault, and abuse. According to a report by the American Society for the Positive Care of Children, neglect the finding in 61% of children maltreated cases, and the leading reason for foster care entry is also often a result of substance abuse. There are several levels of types of physical abuse that can lead a child into a path of substance abuse later in their lives. Traumatized children who crave acceptance or stability may look for comfort in substance abuse, and due to the chronic nature of drug dependency, unhealthy behaviors can persist into adulthood. There are several studies that link childhood trauma to substance abuse, including meth and cannabis abuse. At Destiny Treatment Center, we specialize in offering holistic treatments for mental health issues and their co-occurring disorders, such as trauma disorders and addiction. At Destiny Treatment Center, we specialize in offering holistic treatments for mental health issues and their co-occurring disorders, such as trauma disorders and addiction. Coupled with our compassionate approach, Destiny Treatment Center gives you all the appropriate tools and inspiration you need for a successful recovery. Don't let your traumatic past experience dictate your life. Get help and take back control, because it's never too late.